Okay, guess who I found? Okay, so look, first off, again, I want to thank everybody for joining us. I know some people are jumping in now, and it's tremendous. If you don't know, I'm Representative Dan Miller. Thank you. I want to also recognize our host at Bethel Congregation for bringing us all here and allowing us to be here as always and talking about the importance of disability and mental health and the issues that we need to really move opportunity forward across our state for everybody. So that's what, of course, we're doing here. I want to be sure to, before we jump in, I want to recognize a couple of my colleagues all the way, come on, Joe, all the way from Philadelphia, Representative Hohenstein. Representative Piscatano, not too far off. Thank you, Nick, for being here. Anita Kulik. Representative Kulik is in here somewhere, I know. Well, she's here, trust me. So, so it's good. Look, here's the reality for it, and this is why I'm so excited, okay? First off, the governor is just reminding me how we reached out and had a conversation. Because when I listened to him talk on the campaign trail, I heard something that I had not heard from any gubernatorial candidate. And the reality of it is while we had so many great people who have run for office, and on both sides, I'm sure, a lot of good-hearted people, I did not hear someone really make a connection or make me feel that they cared and understood about the importance of mental health and disabilities. And the reality of it is as soon as I heard the governor, now our governor, talk about it, I said, this is what we've needed. I'm so glad, obviously, he won. But the reality of it is sometimes I get people that come up and they say, you know what, Dan Miller is a champion for disability and mental health. The reality of it is I'm not good enough. This is the man that we need. This is the man that we need. Because when you hear him talk, you're going to see what and hear what I picked up. That he knows it, he cares about it, he's got a vision for the future, he wants to work with us to improve the system, he wants better outcomes, he wants everybody with a disability and a mental health diagnosis to see and build their future here in Pennsylvania and know that they're welcomed. That's what we need. So look, I'm going to come back after he's done. We got a couple things that we need to talk about here. We're going to be navigating some things. I want to thank everybody for joining us, and I know that we did a little bit extra security, but that's because he's important. So look, thank you. We're going to hear now from my friend, your friend, our governor, Josh Shapiro.
Thank you. Thank you. Thank you, thank you, thank you, thank you. Thank you, gang. Thank you. Have a seat. Come on. Thank you. It is awesome to be with all of you. Thank you very much, and it's wonderful to be at this shul that has opened up their doors to all of you for so many years. I want to thank all of you for being here, and I want to especially thank my dear friend, Representative Dan Miller, for pulling us together again this year. I understand this is the 11th summit, the 11th time that the representative has pulled us together, the 11th time he has brought us together to show compassion and love for all in our community, the 11th time we've come together to not only find resources, but to have challenges addressed so that we can be even better at meeting the needs of our fellow Pennsylvanians. And so I want to commend you, Representative Miller, Dan Miller, my friend, for having the vision to pull us together here and to see what you have built here in this community. You know, for 11 years, this summit has filled a critical need for people, not just in your district, but all across Western Pennsylvania, connecting families with the services their loved ones need to be able to live a full and productive life. And I want you to know that this is a summit that is known all across Pennsylvania. This is something that others across this great Commonwealth see and want to emulate. And I believe, Representative Miller, correct me if I'm wrong, I believe I'm the first governor to attend your summit, and I'm proud to be here thanks to you and your leadership. I think it's also really important to note that the issues we talk about here, they don't know any party lines. There's no one party that particularly has an ownership over how we treat our fellow Pennsylvanians with disabilities or mental health issues. Dan Miller understands the power of partnerships to address this, the power of bringing people together from all different walks of life and different parties. And I think that that is critically important even in these hyper-polarized times. I'm mindful that this is a multi-day conference, and I'm here today on the first day. You're going to hear from Lieutenant Governor Austin Davis, my governing partner, tomorrow. I hope you'll give him some grief that he showed up on day 2. I was here on day 1. He's amazing. And I understand you'll also hear from our outstanding county executive, Sarah Innamorato. And why is that important that we're hearing from county and state officials? Because we understand that in order to deliver these resources effectively, we've got to do it at all different levels of government, people working together. And of course, we're going to hear from senators and representatives from the General Assembly. And I'm particularly thankful to Representatives Hohenstein and Kulik and Piscitano who join us here today. And it's important for you to note that they're not just here once a year, that you don't get to see this. I do. They're doing the hard work with Representative Miller behind the scenes to pass bills, to get budgets done, to make sure that the resources we need are there. These guys do the hard work behind the scenes. I'm grateful to them, and you should be grateful to them that you have such a presence here in your Allegheny County delegation that gives a damn about this work, and they truly should enjoy your support for this important work. They're here, I think, for the same reasons I am, to meet you, to hear about what you need, and to make sure that we are delivering more for those in the ID community, for those that are battling mental health issues, that we're breaking down the barriers to entry to get the help and support that you need. And I want you to know that we are all in on these issues in my administration. And there are 2 key members of my administration who join me here today. I want you to have the chance to meet them. One is the Secretary of the Department of Labor and Industry. Her name is Nancy Walker, and she joins us here today. That's Nancy Walker. It's really important that we put folks to work. It's really important that we have them engaged in our communities. And Secretary Walker and her agency does a great job of that. I also want you to meet my Deputy Chief of Staff, Tori Shriver. She oversees all these issues for us. And before you clap for her, I'm going to give you one important fun fact that may make you rise to your feet when you clap for her. She's a Mount Lebanon girl, too. So there you go, Tori Shriver. And look, as I'm sure you can attest to, Representative Miller, I have found that the stories I've picked up along the way, the people who have talked to me about their challenges with intellectual disabilities, the way they've overcome those issues thanks to our help, their stories motivate us to do this work. Their stories excite our passion when it comes to delivering for our fellow Pennsylvanians. And I want to just say one final thing about Representative Miller before I conduct a little bit of business here. He listens in the community, but he doesn't just listen with his ears, he listens with his heart. And that is a big deal when you have a representative who cares deeply and listens with their heart and delivers. And I'm really grateful to him. Just yesterday, I was in Bucks County, Pennsylvania. That's on the other side of the state in the southeastern corner. I was visiting a place called BARC, B-A-R-C. They're a service provider that employs individuals, employs supported individuals and gives them real hope and real opportunity. I got to meet some amazing people there, like Matt and Lisa and Jerome, who told me about the incredible work the BARC staff does for them and the responsibility that I have as the leader of this Commonwealth to deliver for them and make sure they're in a position to provide loving care. The stories that I heard yesterday and that I hear all across Pennsylvania, it motivates me. and it makes it clear that we need to do more to support the individuals who are getting the help and more to support the individuals who are delivering the help in our communities. I want to tell you about Sandy and her daughter, Kate. They live in Westmoreland County, not too far from here. Kate qualifies for more than 65 hours of caregiver support per week. But Sandy, her mom, hasn't been able to find providers with enough staff to give Kate the support that she needs. So many heads are nodding right now because I know you've lived this, you've dealt with this. And so now Sandy of Westmoreland County, she has to be, as a single mom, give up her career to care for her daughter, and is actually taking money out of her retirement in order to cover the expenses that she needs for her daughter. Let me tell you about Cindy and her son, Matthew. They live in Lidditz in Lancaster County, not too far from our state capital. Matthew, her son, who I've had the good fortune of spending time with, he requires 24/7 support, something that Cindy has not been able to find because our state doesn't pay direct support professionals, or DSPs, enough. So instead, Cindy, who is 60 years old, she's a single mom who's battled her own health challenges, had to step in and take care of her son full time, along with Matthew's grandmom. Her name is Judy. They came and visited me in my office last summer. And I want you to know how moved I was by the story they shared. The story they shared is one of so many, tens of thousands of Pennsylvanians. Folks with intellectual disabilities who are wonderful people, who can give back and who can do so much for us. But we haven't given them the support that they need. I remember in my days as a state representative, nearly 20 years ago, they'd show up in the Capitol. They'd wheel their wheelchairs into our offices. They'd ask for help. And then every year, when budget time came, there was an excuse as to why we couldn't fund them. This year, when I delivered my annual budget address as your governor, I asked Matthew and Cindy to be there with me. I asked them to sit in the audience, and I wanted every single representative and senator of both parties to have to look them in the eye and recognize that now is a moment where we need to do right by them. We need to do right by these wonderful people in our community. I have listened to them, and I've been moved by them. And after they've left my office, I've cried by myself. I've called my wife, our First Lady, Lori, the love of my life, and I've said, what the hell are we doing here if we're not supporting them? I've challenged our incredible staff to understand the challenges and come up with a real solution to help them. And the good news is we have one now. The problem here in Pennsylvania is that there are simply not enough DSPs, enough direct support professionals, who can do this challenging and compassionate work of caring for people like Kate and Matthew. And there aren't enough DSPs. You know why? Because we don't pay them enough. It's as simple as that. There are enough good people in Pennsylvania that want to do this work. It's time we pay for this work and show value for this work. Consider this for a minute. We are asking these good folks to work full time, sometimes more than full time, to do this incredibly difficult and challenging work. Yet the current rate that is set by the state that determines their starting salary, well, that paycheck yields less than $15 an hour for folks who are doing that important work. You can earn more working at Walmart or Target. I'm not knocking anybody that works at Walmart or Target, but we should be paying our DSPs at least as much as they're making at Walmart and Target. So consequently, these caregivers, these people with amazing hearts and wonderful skills, they want to do this work, yet they can't, because here in Pennsylvania, we simply don't pay them enough. And as a result, we are facing across the state an 18% vacancy rate, which means we have a shortage of about 10,000 DSPs in Pennsylvania. That's 10,000 people who should be doing this work. And as a result of them not being able to do it because we don't pay enough, that means bigger waiting lists, and it means fewer hours that are able to be delivered in the care that we need. The facility that I was at yesterday in Bucks County in the southeastern part of our state, they have a 48% vacancy rate at that facility. People have to work extra overtime just to be able to care for those who need. People who should be going there 5 days a week to do their work, 5 days a week to get their support, they're only cleared to go 3 days because there's simply not enough staffing. That's a story that we're seeing, unfortunately, all across Pennsylvania. And I'm here to tell you our system cannot continue like this. That's why in my first year as your governor, I directed the Office of Developmental Programs under the Department of Human Services, which is overseen by Secretary Val Arkush, who does an amazing job there. I directed them to conduct an early study of the reimbursement rates that are paid to intellectual disability and autism programs that employ direct support professionals here in Pennsylvania. By asking them to review that rate early, we put ourselves in a position where we can finally address this shortage and do the right things. You see, that rate is typically only reviewed every 3 years. We said, let's do it quicker. And as a result of that review, in the budget I announced, where people with intellectual disabilities were present in our capital to hear us talk about this, my budget, which now Representative Miller and his colleagues are considering, included a state investment of $217 million for direct support professionals, which will allow us to leverage another $270 million in federal money, putting together a fund of nearly $500 million to support those with intellectual disabilities in our community. This would be an unprecedented investment in the needs of this community. We have never seen an investment like this before. That nearly $500 million is going to lead to higher wages for nearly all of our 55,000 DSPs in our state. It's going to mean that that introductory salary of about $15 an hour is going to rise. And the wages for those who are more senior, those like the woman I was with yesterday in Bucks County who's been doing this for 31 years, they're going to see those rates rise. They won't have to take a second job at Walmart just to be able to do the work that they love because we're finally doing right by these communities. This will allow providers to pay more competitive rates so they can both pay their current staff more and attract more staff so we can deal with the shortage that we have in the community. Listen, Representative Miller and his team are now reviewing the budget that I put forth. Representative Piscitano and Hohenstein and others are looking at it. And while, yes, they are getting books and books of spreadsheets with a whole lot of numbers on it, I'm here to tell you, and I know they agree, that a budget is not just about numbers. A budget is a statement of your principles. A budget is a statement of a priority. And a budget reflects where our commitments are for the good people of Pennsylvania. And I want you to know that especially when it comes to the most vulnerable in our communities, my commitment is with you. We need to pass this budget, and I need your help to do that. I want you to know that in addition to the resources, the dollars that we're going to put into raising wages and increasing the number of DSPs that we have across Pennsylvania, I've also proposed an unprecedented $78 million to give 1,500 more Pennsylvanians home and community-based care services and finally get them off the waiting lists here in our Commonwealth. In addition to that, we're launching a multi-year strategy through the Department of Human Services to effectively end the emergency wait list here in our Commonwealth. Hear me on this. No one should have to wait months or sometimes years for these services. All should be able to live with dignity and respect. In addition to all of these investments, we are also doubling down on our investment in mental health because we know that Pennsylvanians with intellectual disabilities don't just rely on home and community-based services, they also rely on their family for support and often use mental health services as well. Consider this, a survey that was recently done by ASSERT here in Pennsylvania found that the top 3 services folks with autism needed were social skills training, behavioral support, and mental health counseling. This isn't rocket science. This is known to us. And these are the services that are clearly related to an individual's mental health. We've done a lot of work to expand mental health services all across Pennsylvania in a multitude of ways. For the first time ever, we are providing $100 million to our school districts so we can hire mental health counselors in our schools for our children that need it most. We've also increased our funding for county mental health support services. So now when you hear from County Executive Innamorato, she has more resources coming from the state to be able to provide better mental health services across our Commonwealth. We are keeping our 988 hotline open and available for those who have mental health needs. We're supporting our mental health crisis walk-in centers. And a few months ago, I directed the state insurance commissioner to reclassify autism as a mental health matter. Why did we do that? Because it makes coverage available to more people under our mental health parity laws, especially for our children. I want you to know, I'm not sure if she's here, Representative Miller, but Representative Jess Benham from Allegheny County has been a leader in this. She joined me when we made this announcement at Drexel University in Philadelphia. This is critically important work. We're going to remain committed to helping those with intellectual disabilities and those who provide services to them here in our Commonwealth. We're going to continue to focus our efforts on addressing mental health in our schools, in our communities, and in our homes. And I want you to know just how committed I am to delivering for you and breaking down the barriers to care. But I cannot do this work alone. This is going to require all of us to work together. Listen, I'm literally the only governor in the entire country with a divided legislature. The House is led by Democrats, the Senate led by Republicans. In fact, here's a fun fact for you. There's only 2 divided legislatures in the whole country, the Commonwealth of Pennsylvania and the U.S. Congress. And take a look at what they get done, right? We're actually showing that we can be a model of bipartisanship, where we can compromise. And compromise is not a dirty word. Compromise is something you're supposed to do in government to get things done. And this is an area where we should find bipartisan common ground. I need your help to get this done. I may be a governor with a title, that may be a representative with a title. We may get a vote or a pen to sign something into law, but the truth is the way we make progress in this Commonwealth is when we all do our part, when we all work together. You'll forgive me, we're here in a synagogue, so I'm going to preach at you a little bit. You know, my faith teaches me, I didn't even do it yet, and you're clapping. Wait till you hear what I say. My faith teaches me, the Talmud teaches that no one is required to complete the task, but neither are we free to refrain from it. Now, I realize we got folks of all different faiths, all different walks of life here, so I don't mean to preach at you or tell you what to believe, but what my faith teaches me, I think, is a lesson for all of us, that we each have some responsibility to make progress. We each have a responsibility to get off the sidelines, get in the game, and do our part. So here's where your part comes in. Phone your legislator. Text your legislator, email your legislator, and tell them to pass Governor Shapiro's budget for folks with intellectual disabilities here in the Commonwealth of Pennsylvania. This is something that should enjoy bipartisan support, and with your help, I know we can get this done. Now, the good news is those of you who are represented by Representative Miller, you're good to go. So ask him for a number of a different representative, and you can call that person and let them know how important it is. Now is a moment where I need your help. We have proposed an unprecedented commitment to these issues. And the only way we get this across the finish line is if we all get off the sidelines, get in the game, and do our part. So I want to end where I began by thanking Representative Miller, not just for having me here today, but for hosting this summit. He showed a long time ago his commitment to all of you and his commitment to making progress on these issues. And on his watch, we have made progress. And on his watch, we've also defined the trajectory of where we need to go. We've got a lot of work to do, and we are relying on you to help us get this work done. I want to tell all of you how important this is to me. We're going to continue to fight for you. We're going to continue to work with you and alongside you to get it done. And I want to thank you very much for having me here with all of you today. Thank you so very much. We appreciate you. Thank you. Thank you.
Okay, now listen, I'm going to ask you to hold tight. We need the governor to be escorted out through the store here with your staff. I need you all to hold tight. But and you feel free to sit down because it's just going to be a moment. And look, I'm so glad to see your reaction because you were seeing what I saw, okay, which is a man who's wearing his heart on his sleeve for mental health and disability issues. I can't tell you the game changer he's been on these issues, how he's created a staff that is working like this when we bring an issue up, and he's trying to find solutions. And that's what it's all about.